after you got your SIBO diagnosis, what were your next steps? Like, what was the very next thing you did?
Yeah, well, I looked at the handout that I had originally gotten for a while and was like, how am I going to make this work
Low
with the
FODMAP handout?
also, yes, so the low
Yeah.
FODMAP pen was still a vegan. I was still vegan at the time, and so like looking at that, it's very limiting and kind of not having any further resources. So when we don't get a lot of resources, we turn to the internet, which makes complete sense because we're looking to see what answers we can get.
Yes.
So I turned to the internet, ended up working with a naturopathic doctor as well. And kind of between the first thing I did after my diagnosis with SIBO was I went on a round of rifaximin. I had hydrogen dominant SIBO, so that at the time was the validated kind of approach they were taking, still is.
Mhm.
And through that, felt better for like 2, 3 weeks after, and then immediately felt my symptoms again,
Yeah.
which was very frustrating at the time. So then I went to work with a naturopathic doctor and kind of got a different version of also just not unfortunately getting the care that I needed because it was a ton of supplements. I like to joke it was a bucket. It's not funny now, but at the time it was a bucket of supplements. And it was, a lot of things that are actually very helpful, that I think if we're very strategic about, if you work with, someone who is an expert, in their field, and we're very strategically putting in certain supplements to help with things like motility, that can be helpful. But when we're putting so many things, I like to say too many things in the pot,
Yeah.
it can get really overwhelming to the point where there's not even room for food sometimes when you have that many things on board, and it kind of is counterintuitive at that time.
Yes. So you kind of went from the medical doctor more to this
Yeah.
naturopathic doctor and having
Yeah.
that shift from the antibiotic care into more of that herbal protocol.
Yes, and I'd also had done an IgG food sensitivity test, which I'm sure many of our listeners might be familiar with, which it at that time and now is not really a validated and helpful test, though I do understand why so many people, including myself, go for it to try to get more specific information, but
Yeah.
it limits my diet even more. White rice came back as like my top food that I couldn't tolerate. I eat white rice every single day now, all the
Yeah.
time. So it was not something that I was sensitive to. And I know we've talked about IgG antibody tests on other videos we've done, but it definitely is one I would caution against. So that's why I'm so happy when you had your team. They were really giving you evidence-based information so that you didn't feel like need to kind of go towards your testing. Did you feel like the
Yes.
information you kind of got after your diagnosis felt supportive at the time too?
Yeah. I mean, like, supportive. I think it was just kind of like the GI doctor was like, "Oh, you tested positive for the hydrogen and methane SIBO. Here are your antibiotics." Like
Yeah.
it wasn't
Yeah.
really like I don't even think I saw my GI doctor after that, which like would have been nice to like see her in person, but I got like a little message in the portal like this is what we found. Here's the next
Okay.
steps. Go pick up your prescription at the pharmacy. And I was like, okay. So I did like, I think it was 2 weeks of rifaximin and neomycin. So the rifaximin's for the hydrogen and then the neomycin's for like the methane dominant.
Yeah.
Um, and that was like an interesting experience during the treatment. I think
Yeah.
no one really talks about that, like what's going on like while you're taking the antibiotics or
Yeah.
how to
Yeah.
support your gut health. So
Yes.
during that time, my doctor was like, "Hey, like, don't take probiotics during this," which I was like, that's kind of the idea that I've gotten from research that I've read as well as like not the best time to take probiotics. So
No.
that was out
Yeah.
of the picture. And then, as I mentioned before, like my major symptom that I was dealing with was like orangey loose stool, but I
Yeah.
never really had that like major bloating or abdominal pain that like is highly correlated with SIBO until I started taking antibiotics. And I don't know if that was
Mhm.
something to do with kind of like that die off period or like if just other things were getting kind of thrown off a little bit in my microbiome. So during that time, I was like, oh my gosh, like I am distended, I am uncomfy, like this is not fun.
Yeah.
Knowing myself, and I live in like in my house, it's me and my husband, and he's vegetarian. So like it's very tricky to avoid very like high FODMAP foods. Like we eat a lot of beans, we eat a lot of tofus and stuff. And um so I kind of took like a FODMAP gentle approach during my antibiotic treatment, just kind of like avoiding like a ton of onions, a ton of garlic, like got sourdough bread, eat the little bit of a greener banana. I do have Fodzyme, so I was using like Fodzyme if I wasn't sure if we were eating beans so that like my diet wouldn't be restricted because that's something too is that when you are taking antibiotics, like yes, we're hopefully killing off the pathogenic bacteria, but we also want to try to like it's going to also be damaging our some of our good bacteria too. So I was looking for ways to also to support my gut health during that time. So I was trying to eat like a lot of very gentle but prebiotic fibers that are lower FODMAP
Mhm.
that I know about. And then I was really trying to support myself like in other factors too. So I was
Mhm.
staying super hydrated. I was trying to manage my stress and my sleep because I know that all these things affect my gut health and
Mhm.
affect like maybe even like the severity of the symptoms that I was feeling. So I was doing yoga, meditation, limiting screens before bed so I have good quality sleep. And that was kind of like my experience during the antibiotics. You mentioned that you felt better. Did you feel better even during the antibiotics, or what did you remember? I know it was a little
Not
while
dur- yeah, not during the antibiotics, but no one talks about how big they are.
ago.
They are
And
huge.
one of them, I can't remember if it was a rifaximin or a neomycin, but one of them tasted so bad.
I think it was Rifaximin because that's what I remember too. And
Ugh,
I, they are the biggest
they're
pills you'll
huge.
ever see.
Yeah.
And you're trying to get them down. They're also like a cute pink color, but then you're like, okay,
It's
um,
only helps so much.
fun. So yeah, I remember that like when I was taking it, I still was feeling my symptoms. I wasn't feeling better. And one thing that I talk to a lot with my clients now, and I'm sure you do too, is like there is kind of this waiting period where we're kind
Yeah.
of allowing things to happen, allowing, the die-off effect, after
Yeah.
SIBO.
Which we'll
So
totally get into in the next call too, because like that's just the whole thing is like
yeah,
after treatment, like what does life look like? Because it's not always just like all my problems are
not
solved.
yeah.
Yeah.
You know, and unfortunately, because I think there was just like less information available to the providers I was working with when it came to SIBO, I went on multiple rounds of rifaximin
Okay. Yeah.
because it didn't work. It wasn't working. So probably three rounds of
And
rifaximin.
I think like from what my doctor told me, I think they try to do like a maximum of 2 rounds nowadays before they try to do something else.
Yeah, they didn't do that at the time, and like Fadzyme being a part of the game now is so big. I'm not being paid to say that. It's just
Yeah, we
like
are not no Fadzyme
like no
sponsorship here,
affiliate,
but
but like at the time, I was eating so bland, and then I actually did go off a vegan diet after some of my treatment because if things were so restrictive, and starting to have to kind of transition. And I can definitely talk to more about like what that looked like as well.
yeah.
Actually
So I mean,
now.
did you kind of like identify that restriction as your root cause? Because I think that's something that we talk a lot about is like, okay, we can treat the issue, but in order for it to not keep coming back and back, like we have to figure out why we had the issue in the first place. So that root cause is kind of something that's really worth identifying. I don't know if that's kind of like what you landed on for yourself.
Yeah, root cause was really important, and it was kind of me figuring that out. Both sides of my providers, both from the gastroenterology side, the naturopathic side, really did not address my root cause.
Yeah.
And I think that's more just because of the lack of information at the time. Um, it came to the point where one side was suggesting low FODMAP, the other side was suggesting very limited meals during the day. At one point, I was having liver in
Mhm.
my kitchen because I was so deficient, and I was being to eat liver and to eat this. And my mom is awesome, and she was making it for me. I don't know how she went through that, but at the time, really starting to realize like I really think I need to heal my relationship with food. So I actually I don't suggest doing this. Work with your providers, but I actually went off all supplements after during my SIBO treatment, kind of after my SIBO treatment, decided that I really needed to scale back and actually simplify the plan. And I do think that's something a lot of our clients go through is sometimes they have thrown so many things at their symptoms that it's almost counterintuitive and it's hard
Yeah.
to know what's working. So sometimes scaling back can feel scary, but sometimes it's necessary to kind of get to that healing point and starting to look into this root cause. So definitely landing on nervous system dysregulation, motility issues, erratic eating patterns, starting to really look at that. My relationship with food was the pivotal step, and towards my SIBO treatment.
Yeah, and I think for me too, when we're learning about SIBO and the root causes of that, a lot of times it is maybe something structural or surgical or anatomical that's like causing some sort of um, dysmotility or something that having that overgrowth in your small intestines. Sometimes it's that underfueling or other like habits that can kind of affect that motility or affect the health of your gut microbiome. And I think for me, that's why it was so like frustrating. I was like, "Ugh," like I know how to eat well. I know
Yeah.
how to do these things. And I was like, why the heck do I have SIBO? And really trying to figure out the cause. It's not always so obvious. I think for me, it was likely related to like post-infectious IBS
Yeah.
because that's something that I've recently learned about, like how highly correlated it is between like getting food poisoning, developing IBS, which can down the road kind of develop into SIBO. Um,
Yeah.
and like I was like, oh my gosh, I've had food poisoning like 4 times in the past like 4 or 5 years. And I'm like, I don't think that's good. And like just getting food poisoning once like increases your chance of getting post-infectious IBS like so much that I'm
Hmm.
like, okay, 4 times, like maybe that had something to do with it.
Yeah.
But I also like it caused me to kind of reflect on myself and reflect on my life. I'm like, okay, maybe I'm not doing a great job with like stress management. Maybe I don't have really set boundaries between work and life. And just really knowing how much your nervous system plays a role in your gut microbiome health and your GI motility. That was a big thing for me that could also be, a piece of the puzzle and kind of identifying that root cause. So really trying to prioritize that stress management was big.
Yeah.
I did get a question on my page about whether SIBO can be genetic. And I think that's a really interesting question because a lot of health conditions can be, but SIBO itself is not genetic. It's more of like you can have a certain health condition that is genetic that predisposes you to getting SIBO or increases your risk of getting SIBO. So that could be things like if you have an untreated GI condition that is
Hmm.
genetic, like celiac disease,
Yeah.
or if you have like diabetes, for example, is highly correlated with your genetics. And
Yeah.
if you have diabetes, sometimes that if it's poorly managed, it can disrupt your GI motility, which can
Hmm.
then cause it can lead to that overgrowth in your small intestine. So those are things to keep in mind too, that like there are other things, other factors, other genetic conditions that can play a role, but also like our lifestyle, our dietary choices, how well we're nourishing our bodies, like all of those things too.
Yeah, absolutely. And my new favorite thing, and I'm sure you kind of agree with this too, is, I always tell my clients that it's not their fault, that
Yeah.
they have developed GI conditions, or GI symptoms. The reality is that your body just might need a little more care. I know we all have that one friend that can like have coffee first thing in the morning and then like not eat till this hour and then they're totally fine and they go throughout their day. They have great bowel movements and they do all these things. And the reality is for a lot of us that might not work. We would be
Yeah.
really bloated, really uncomfortable if we did things like that. So it's always working with your dietitians, working with your doctors, getting that personalized approach. That's so
Very
important that
personalized.
you're seeing as well.
Yeah. So other than that, I mean, like your treatment itself, do you feel like it was challenging? Like, did you support your gut health in any other ways? Because, like I mentioned, like I was really trying to eat prebiotic foods and made a couple other dietary adjustments and lifestyle adjustments. Like,
Yeah.
what was that journey like for you? Were you kind of like, oh my gosh, I need to do all these things at once, or just do the antibiotic right now?
Yeah, this is this is a good question. So it was challenging to say the least. I was a part of the group, of many, individuals, and we're getting a lot of messages where I assumed nutrition was the only issue, and it was my fault that I was not getting better.
Mm.
So really struggling with, I think at the time started doing what I didn't know at the time was the FODMAP gentle approach,
Oh,
because I wasn't a dietitian yet. And this is kind of where my dietitian journey started. I started getting really interested in nutrition. And this is kind of when I did decide to pivot to becoming a dietitian and working towards that because I had been dealing with my own issues for so long and knew that I needed the education and the expertise to become a dietitian to help others because everyone's going to be a little bit different. So pivoted towards that. But I didn't really look into the nervous system side, the lifestyle side, the mealtime hygiene of chewing and movement and, having stress relief. I did start, one of my providers, I think along the lines, did mention Nerva to me. So that was the one tool that
which
I
is
did,
amazing.
which was really, I don't remember exactly who suggested that to me, but thank you to whoever did, because
Yes.
it definitely was helpful in starting to kind of pivot towards, okay, it's not just food.
Can
That's
you explain what Nerva is for anyone who's listening who doesn't know?
so Nerva is gut-directed hypnotherapy. So it kind of sounds like really like, ooh, but it really is just focusing on, the mind-gut connection, really focusing in on it's not just kind of meditation, it's more kind of hypnosis, and breathing kind of combined in one. And it's been shown to be extremely helpful in
I think
visceral
like as
activity.
helpful as a low FODMAP diet. Like
Yeah,
it's pretty powerful.
extremely powerful. And I've had a lot of clients who've started with Nerva. I had Nerva, I absolutely love it. If it's something that is accessible to you, and if it's something that is recommended to you by a provider, I highly suggest
We're
trying it
also
out.
not being paid
Not
by
also
them to
not
say this.
affiliated with Nerva.
We
But
genuinely love it.
So helpful. So that was really helpful to start pivoting kind of towards that. But it was honestly about 3 years of trial and error. So like from getting the SIBO diagnosis towards kind of when I started to kind of feel better and really work on my relationship with food was about 3 years. So
Wow.
definitely, and most of that being on the low FODMAP diet, definitely. And it can be a very helpful tool for the right person, but at the time it is lower in diversity, realistically, the low FODMAP diet. So that doesn't really help us from the gut microbiome perspective. So definitely the point is using low FODMAP as a tool with the right provider, like your GI dietitian, and then really figuring out your unique triggers. And I think I started doing that naturally. So at the time, I kind of figured out that garlic and onion and large amounts of wheat were
Hmm.
my personal dietary triggers. And then FODZEN came around, not affiliated, but it was amazing at that time. But then I was able to introduce the like 60 plus foods that, were outside of those that
Yeah.
I had paused for years, that's my favorite part of working with clients, and I'm sure with you as well, is really getting to be able to reintroduce these things and really making life feel bigger again, because it can
Yeah.
feel really frustrating and isolating when you're dealing with these issues.
Absolutely. No, I totally agree. And I think it'll be really interesting for us to talk about next a little bit more about how when we finally started to feel that change, when you kind of know, like, okay, things are looking up, my symptoms are resolving, and what that experience was like, and kind of this life after SIBO treatment. Like, okay, this happened. How do I prevent this from happening again? Or, I might have other residual GI symptoms. How am I still managing those? Like, what are other things that I'm doing in my life, moving forward to like continue to take care of my gut?
Absolutely. Oh, I'm so excited. This is my favorite part.
Yeah.